The study I'm going to be speaking about today discusses the effectiveness and safety of enoxaparin versus unfractionated heparin as thromboprophylaxis in hospitalized COVID-19 patients. COVID-19 is a contagious disease caused by the acute respiratory syndrome coronavirus 2. After SARS-CoV-2 binds to the angiotensin-converting enzyme 2 receptor, upregulation of inflammatory cytokines occurs, which can cause complications such as acute respiratory distress syndrome. The upregulation in inflammatory cytokines can also cause vascular injury, inducing a hypercoagulable state and eventually resulting in venous thromboembolism. The poor prognosis associated with COVID-19 VTEs promoted research on recommended prophylactic anticoagulation. As part of COVID-19 treatment protocols, it is recommended that all COVID-19 patients not at high risk for bleeding receive anticoagulation therapy for VTE prophylaxis. A study by Spiropoulos showed that a therapeutic dose of heparin reduced thromboembolic events greatly in COVID-19 patients. However, researchers postulate that the type of anticoagulant may be related to the effectiveness of thromboprophylaxis in COVID-19 patients. Because of enoxaparin's chemical compounds, it may be more effective in COVID-19 thromboprophylaxis than unfractionated heparin. In the hospital setting, I have given both heparin and enoxaparin to COVID-19 patients, and typically enoxaparin has provided better clinical outcomes. The article I found was published online August 8, 2022 by Ahmad Alamer, Department of Clinical Pharmacy, along with other researchers in Saudi Arabia. It was published in Annals of Pharmacotherapy, Volume 57, Issue 4. The study was done on hospitalized COVID-19 patients greater than or equal to 18 years old who were admitted between January 1st and December 30th, 2020. Patients selected were given either unfractionated heparin or enoxaparin therapeutic doses in the subcutaneous tissue of the arm. The goal of the study was to show which thromboprophylactic resulted in reduced thromboembolic events. The study was conducted via medical review at Dammam Medical Complex. The study was externally reviewed and conducted in compliance with the Institutional Review Board. Authors followed the statement checklist for strengthening the reporting of observational studies in epidemiology. There were 470 patients who received enoxaparin via subcutaneous arm and 510 patients who received heparin via subcutaneous arm. In the unadjusted analysis, there was significant reduction in the primary endpoint in favor of enoxaparin, 15.1%, compared to heparin, 19.6%. The unadjusted analysis showed fewer thrombotic events in the enoxaparin arm, 5.1%, compared to the heparin arm, 9.4%. Due to the overall greater reduction of thrombotic events when using heparin, my recommendation in nursing practice would be to use enoxaparin in hospitalized COVID-19 patients compared to using heparin.